Good morning, good afternoon, and good evening, everyone. First of all, we'd like to warmly welcome you to this digital dialogue on parent and caregiver supports with a special focus on financing. My name is Sabine Rakotomalala. I work for the World Health Organization, and together with UNICEF, we're organizing this digital dialogue series over the past 8 weeks on different topics. As many of you probably know, in November last year, we held the first ever Global Ministerial Conference on ending violence against children. It was a historic milestone. We had over 1,500 people, 120 countries, 80 ministers, young people, survivors, civil society organizations, UN agencies, and donors. And most importantly, governments engaged in pledges, 101 pledges that they will be implementing over the next few years until the next ministerial conference. Alongside these government commitments, we are trying to strengthen the connection between the different areas of work linked to violence against children, which is why we've organized this digital dialogue series. Some of you might have participated in the first 6. There was one on online violence prevention, on children in alternative care, on ending violence in and through schools, on children and the justice system. And so we're very excited to see these different communities of practice take the lead. We're creating a space for them to exchange strategies, to foster cross-regional learning, and to celebrate progress. And so we're really putting governments at the forefront of these digital dialogues, but also involving a technical expertise, young people and or survivors, and civil society groups that are often very involved in the implementation. So we are very excited that many of you have registered today. We have an exciting program. We will start with Philip Goldman from Maestro, who will give an overview of what parent and caregiver support is about and the context that we're in today. Then we'll hear from Brianna, a young person who's been engaged in parent and caregiver work. We'll hear from Shekufe, who will give an overview of the pledges that were made in Bogota around parent and caregiver support. And then we'll dive into some country examples, namely Pakistan and Zambia, that are countries that not only made a pledge on parent to caregiver support, but also have allocated budget to this. Then we have a panel discussion with great speakers from Grand Challenges Canada and ICS. And then we have some time for the Q&A. So without further ado, I am going to hand over to Mr. Philip Goldman from Maestro. Over to you, Philip.
Thank you, Sabine, and what an amazing turnout for such an important topic. So thank you all for being here today. All those pledges in Bogota really don't mean anything without resources being pulled together to make them a reality. So I think the amazing turnout is because you all understand that and see the importance of today's topic. But I'm going to start us off doing something a little unusual. I want us all to imagine that we are at a completely different meeting than the one we signed up for. Imagine that you are a group of big shot bankers and you are seeking to buy companies, to restructure them, and to resell them for a profit. So a finance meeting. So one of the phrases we would be throwing around to each other is what is called multiples on invested capital. And put simply, that means that if you buy a company for, say, 100 million euro and you sell it for 200 million euro, you've doubled your money, obviously, and your multiple is 2 times. Now, as bankers, most of you are thinking that you want your investment over time in that company to maybe double or triple. That's pretty good return. And occasionally, you might see a bit more than that, 4 or 5 times, and that's just an outstanding return on your investment. Now, I want you to come back to this meeting and our topic. What if I told you that you could not just match, but beat those Wall Street hotshots if you could mobilize investments in parenting and caregiver support? Susan Horton and Maureen Black conducted an economic analysis of an essential and holistic package of services for young children in lower and middle income countries. And they found that their multiples were coming in at about 2 to 5 times. So that's already at and above what Wall Street is looking through for, in private investment. And then UNICEF and its partners reviewed 8 parenting programs for preventing violence against children. And they found really outstanding ranges, multiples from about 3.75 times all the way to 16.1 times. And then in higher income settings, the returns seem to be higher, and I'm not entirely sure why. It may be the quality and range of the services that are being provided. But I looked at a robust data set from Washington State here in the United States, and I found that the average multiple across 18 parenting programs was 7.6 times every dollar spent. The best performing program, a very high quality program, was 30 times every dollar spent. So who should be on Wall Street? You should be on Wall Street showing those bankers how it's done. Now, you could look at these economic returns in all sorts of ways. I just went through multiples, but you can generate the dollars that a particular intervention generates. You can look at the internal rate of return, which is like an interest rate, or the costs of inaction, or the difference between the costs of different interventions, whatever works for you. But for example, a research team assessed a parenting program, and rather than looking at multiples, they showed that program generated $2,742 per case of violence averted against an estimated cost of $972. So if that's the metric that works for you in your dialogue with funders and counterparts and ministries of finance, use it. I do tend to avoid the costs of inaction. I know that that is one metric that we use. If we don't act, this will be the cost. I find that a bit of a negative pitch. I think what works a little better for us, at least in our dialogues, is to get funders excited about the benefits of investing. But that really depends on your context and what works for you. So where are these returns coming from parenting and caregiving support? They're coming from increases in human capital. These include better educational outcomes that lead to higher lifetime earnings. They also result in a lower prevalence of lifetime disease. All sorts of studies show that, as well as higher life expectancy. In addition to strengthening human capital, your investments in parenting and caregiving support will reduce a wide range of social costs, from the cost of healthcare services to those associated with criminal justice and incarceration, and many more that we could list here. Now, you put all that together, the human capital and the lower costs, and you get high value for money. And that, with these returns, these high returns I'm mentioning, that contributes to economic growth, to poverty reduction, and to social cohesion. But how to make the pitch? You're going to be hearing from a lot of great speakers today and panelists, but let me highlight 3 principles before I close to keep in mind. First, if you're going to use the language of human capital, you're going to have to nest parenting and caregiver support in broader social policy as a whole, namely health, education, and social welfare. Policy makers and investors need to see that caregiving is not something on its own and in the abstract, but an essential and core component of a well-functioning society, whether at the household, family, or community level. Okay, not a standalone. Nest it, show how this links to the government's broader social goals. Second, we need to think about new models of finance, especially as donor funds are drying up today. So this means partnerships between multilateral funders like the World Bank, of course, getting government budgets to step in, and utilizing and leveraging whatever external funding partners that we can get. And on that, we need to think much more about innovative models. So that means development impact bonds, that means diaspora bonds, that means human development credits, kind of like carbon trading credits, carbon caps and the like, and public-private partnerships, of course. Now, finally, we need to embed making the investment case in our daily work. And now, we at Maestro, we've been asked in the past to do costings and investment cases, and that's great. They generate important and useful data for advocacy, but you can't stop there. If you're in a country, or if you're working with a country, you need to make advocacy for resources part of your daily and weekly work. The health and education sectors are terrific at this. Those of us working in child protection and child welfare, we still have a lot to learn. So it's not just a one-off. We generated the investment case. Here you are, government. Make that the case every day. So I'll leave you with one thing. The next time that a relative tells you that you should have gone into finance and not into the social sectors, you tell them that you already have, and that your investments are enriching our collective futures. And with that, thank you very much. Sabine?
Thank you, Philip. I really appreciate, as always, your wonderful presentations. We're assuming you will notice in this webinar that you know what parent and caregiver support is, that you know what it's about. But we're going to hand over to Brianna now. I really love the start with Philip bringing us to the banking world and to the finance world, which is so essential, the case to be made. And now Brianna will take us on to a young person's perspective on why parent and caregiver support is essential. Over to you, Brianna.
Okay, so hi everyone. I hope you all can hear me. Good evening from the Philippines. My name is Brianna Marinas, and I'm the founder of the Global Youth-Led Movement on Ending Violence Against Children. So I want to start my intervention today with something simple. We cannot expect to safeguard children if we don't also safeguard the people who raise them. Parents and caregivers carry so much responsibility in shaping the next generation, and yet they're so often left to figure it out alone. So just last week, I was actually part of another digital dialogue where the World Health Organization launched its landmark report on the public health impact of corporal punishment. Corporal punishment happens in many settings, but it is most common in the home, the very place where a child should feel safe first. And over 1.2 billion children around the world experience it there. At the event, I also screened a short film I worked on that centered the voices of adults who had been violently punished as children. And what struck me the most, and I think most of you can resonate with this as well, is that even though they promised themselves they would be different with their own kids, to raise their children non-violently, in moments of stress and anger, they still feel the urge to shout and to spank. Because the reality is, when you grow up in a household where love and discipline are expressed through violence, and where parents never learn how to talk about their feelings or how to resolve conflict without shaming, violence often becomes the default response. Parents don't want to hurt their children, but many simply don't know what else to do, because that's exactly what they grew up seeing and experiencing. And this is exactly why we're here today and why parent and caregiver support is so important. It gives people real alternatives. It equips them with the tools to know what is safe, healthy, and what playful parenting can actually look like in practice. And most importantly, it helps break the cycle of violence before it even begins. So 2 years ago, I also started working with the nonprofit Masayang Pamilya here in the Philippines to co-develop parenting programs for parents of teenagers and for teen parents raising babies. And from my experience this past 2 years, when the support is there, you can really see the change. Children and teens actually thrive when they feel safe and routines are in place. Parents feel less isolated, less depressed, and even more confident. Families, whether it's siblings, grandparents, or caregivers, learn how to work together instead of breaking apart under stress. And as a young person myself and the eldest child with 3 younger sisters, I've even used some of these skills myself to parent them and to be their ate. But of course, the impact of parent and caregiver support doesn't stop at home. Strong families build strong communities, and a child who grows up safe and in a supportive environment is more likely to thrive in schools, in friendships, and even later in life. But on the flip side, when violence happens at home, its effects ripple outward too, into schools, workplaces, and society as a whole. My generation is so fond even of reflecting back on how our own childhood trauma affected us as adults now. And we want to make sure that this doesn't happen for the next generation. And so if you ask me, the core of it is, from a young person's perspective, parenting and caregiver support is not optional. It is prevention, it is protection, it is hope. If the home is the first place a child should feel safe, then parenting and caregiver support is how we should truly make sure it is. Because as I mentioned earlier, you cannot expect to safeguard children if you don't safeguard the people who take care and protect them. Thank you.
Thank you very much, Brianna. I don't know if any of you have read the book Purple Hibiscus by Chimamanda Ngozi Adichie. It's a wonderful book about violence in the home, but it also just marks exactly what Brianna is saying, how sometimes parents, they're not bad people, they're doing what they can, and it happens because they don't have other alternatives or skills. So as Brianna said, and as Philip said, the more we can bring that support to parents so that they can find alternatives to violent disciplining, the happier they will be and the happier society will turn out to be. With that, I want to hand over to Shekufe, who's been from ECDAN, who's been doing incredible work bringing together the Global Initiative to support parents, and has also carried out a review of the parent to caregiver support pledges from Bogota, and will give us an overview of that pledge analysis. Over to you, Shekufe.
Thanks, Sabine, and good morning, good afternoon, good evening, everyone. It's my pleasure to be here today. I am just pulling up the file. I'm looking forward to sharing this presentation with you. Let's go. All right. So really excited with that wonderful background that we got so far to share with you a very brief overview of the parenting pledges that were made in Bogota last year. And since then, I hear there are some updates, but this mostly holds true. So here are the countries who had specific pledges around parenting and parenting support. 52 out of the total 104 pledges included parenting support. I'll give you a second to memorize the countries. In terms of regions, we had a lot of countries from the Africa region, about 46%, and then we had an even-ish distribution across Asia, Europe, North America, and South America. There were a range of themes when we analyzed the parenting support, and I want to credit Dr. Isang Awa, who's also a very wonderful collaborator on GISP, who helped with some of this analysis as well. Some of the themes were scaling up evidence-based parenting programs, integrating international policies and systems, using digital innovation solutions, violence prevention, early childhood development, supporting marginalized high-risk families, and mental health and psychosocial support. In terms of the pledges themselves, about 20 out of the 32 did not have very measurable pledges where you can actually measure what will be done when. They were a bit abstract, but 32 out of the 52 had measurable pledges. The number of pledges that actually said how much funding will be allocated were only 10, and only about 30 of them had clear timelines for implementation. Countries where universal program commitments, that means they were committing to having national level programs. These were the 10 countries that had prioritized that, which is quite amazing. And what we noticed was the pledges were done with ownership across a range of ministries. Some pledges did not note specifically which ministries, but there was a range from ministries of health. Some had interministerial committees, departments of gender and family issues, and various social sector ministries. Here I have actual quotes from the pledges, so you get a flavor of the type of commitments people were making. In terms of the scale, more than 60% of the countries committed to improving parenting knowledge and capacity. So for example, in the Dominican Republic, they were going to invest to provide families with the space to reflect and generate new learning about parenting practices. In Pakistan, there was a commitment for nationwide parenting interventions, reaching approximately 28 million caregivers. In Guinea-Bissau, they had commitments to implement a national parent education program by December 2030. So there was a whole range of commitments around scaling parenting programs. In terms of the type of parenting programs, there was a whole range of them, including supporting caregiver well-being and mental health, strengthening economic empowerment, increasing access to basic services. And here are just some examples. In Kenya, there was a commitment of improving nutrition through a cash and health education and including parenting there. In Burundi, there was a commitment for a positive parenting, psychosocial support, and mental health. Apologies, I'm just recovering from COVID. In Hungary, there was a commitment on social protection and parent support for families. So you see there's a whole range. In the Philippines, they wanted to strengthen caregiver support because when parents have strong livelihoods, they can engage in parenting. So improving economic and livelihood. There was also commitments across countries for strengthening national laws and policies. So for example, in Jordan, they wanted to continue to institutionalize parenting education program in all their social sector ministries. In Panama, they wanted to develop a multi-sectoral inter-institutional strategy, a national family policy in Uganda. In Benin, they wanted to enact a specific law prohibiting corporal punishment. And in Kyrgyzstan, implementation of national standards for parenting programs. So there's a whole range of the type of commitments countries made in the pledges. There was also strong support for strengthening workforce, social norms, and investing in data systems. So for example, the United States committed to improving national administrative data. Chile committed to promoting community awareness strategy to address social norms that validate violence against children. And Brazil committed to promoting distance learning and self-instruction to over 20,000 primary health care professionals over a period of 18 months. So there's a whole range of commitments, as you can see there. And these were the countries that actually named very specific financial commitments, allocation commitments for parenting. So this is a very brief overview, and if you want to learn more about the pledges, that is available on the pledge dashboard that Sabine and colleagues from WHO can direct you to. But this is just a quick overview of the parenting pledges. Thanks, Sabine, back to you.
Wonderful, Shekufe. Thank you so much. And just so you know, we'll also be working over the next few months in more in-depth analysis. I think Shekufe provided a great overview, but we want even more analysis of what's behind these different parent to caregiver support pledges. As probably all of you know, there were 3 breakthrough areas that came out of Bogota, of the Bogota Declaration: parent to caregiver support, school-based interventions, and child-friendly response services. So this is a really important one, as we've now heard from Brianna, Philip, and Shekufe. Now I want to hand over to our colleague from UNICEF, Christine Colby-Stewart. They're working on an incredibly useful conceptual framework that really gives an overview of what's needed to put parent to caregiver support in place and to scale it up. Over to you, Christine.
Thank you, Sabine. It's a pleasure to be with you today and to talk to you all about, as Sabine mentioned, the global conceptual framework for the provision of universal parenting support, which UNICEF, with our partners in the Global Initiative to Support Parents, has been developing over the last year or so. The framework responds to a UN policy call for the provision of universal parenting support, which, recognising the strength of the evidence on the impact of parenting programmes on multiple development outcomes, has seen a great and continued momentum around advocacy and programme development between UN agencies and our partners towards the achievement of universal parenting support. So I'm just going to speak for a few minutes about what the parenting support framework is. You're getting a sneak preview. It's only just being finalised and is yet to be launched. But essentially, the framework is a structured, conceptual approach to universal parenting support, attempting to offer clear guidance and strategies for effective programming. It's defining what universal parenting support means, responding to that policy call, and what it encompasses in policy and programmatic terms across the life course and across the world. So it offers a unified multi-sectoral vision for parenting support to ensure coordination and alignment across all of the important sectors that are involved in the provision of universal parenting support. It focuses on building and reinforcing the capacity of local and national systems to deliver integrated, sustainable parenting support services, and it leverages social and behaviour change guidance to influence parenting behaviours and promote positive evidence-based practices for child development. The framework is notable because it draws from scientific evidence and promotes equity by addressing the diverse needs of families worldwide. It supports every child's right to a safe and supportive upbringing, and it highlights the economic benefits of investing in parenting programmes to build stronger, more resilient communities. Next slide, please. So the primary objective of the framework is to conceptualise parenting support needs across all stages of child development, so early childhood, middle childhood and adolescence, and to be a relevant and applicable guide for all regions of the world. It sets out the concepts that contribute to an enabling environment and strengthen systems, and it supports multi-sectoral integration, evidence-informed decision-making, and the delivery of high-quality, sustained parenting support systems worldwide. So the intended audience of the framework includes UNICEF stakeholders at global, regional and national levels, but also policymakers, ministries, intersectoral bodies, local authorities, and other decision makers across health, education, social protection, and child protection sectors. And the framework also provides guidance for international organisations, donors, and implementing partners who are seeking to align their strategies with a unified multi-sectoral vision for parenting support. Next slide, please. So here is a preview of the framework as it looks as an image. So the framework is, as you can see, comprised of several key building blocks that attempt to provide a comprehensive approach to parenting support. The framework's built around a socio-ecological model that centres the universal progressive parenting support pyramid, which many here will be familiar with, which attempts to nuance considerations of scale and need in relation to parenting support. It also draws on the role of strong systems in supporting parents and all of the factors that contribute to a strong system for supporting parents. And it references the important role that the enabling environment, including the broader economic and environmental context and the influence of social norms, has on parents and parental behaviours that we seek to influence. And within the system building block, and of much relevance to our discussion today, is the component of the framework on financing parenting support, which you can see here on the diagram. The framework notes that sustainable and quality parenting support depends on adequate, predictable and strategic financing at national and subnational levels. Yet, despite growing recognition of its importance, only 26% of governments report that parenting programmes reach all parents in their countries. So the framework sets out the key arguments for financing parenting support, which Philip very rightly pointed out at the beginning we continue to need to make the case on. And this includes the rights-based social imperative for investing, as well as the potential economic return afforded by this sustained human capital investment. It describes what effective and equitable financing looks like, including integration within sectoral budgets, responsiveness to needs-based assessments within populations, financing that factors in not only service delivery, but also monitoring and evaluation, outreach, workforce capacity building, and funding for community engagement, and financing that leverages existing infrastructure and delivery platforms to maximise fiscal efficiencies. And helpfully, the framework also sets out 7 strategies to support advocacy for financing parenting support, which is so often needed, and provides examples of different financing models from 5 different countries. We're really excited that in today's webinar, we are going to have the chance to hear from a number of other countries who are making strides in financing parenting support. We hope that the conceptual framework is a support to governments and partners in these efforts. Please watch out for its official launch later this year. And we look forward to providing this resource to the community. And with that, back to you, Sabine.
Thank you very much to Christine and to UNICEF. I think this conceptual framework, as Christine was saying, was developed by the European region, and it was tested in a whole bunch of countries. And actually, the European region is a few decades ahead of other regions. So it's really great to have a vision of what we want to achieve and then see how we can all move together. So huge kudos to the UNICEF team that have been developing this framework over the past few years. And thank you, Christine, for the clear presentation. With that, moving from our brain, we're going to move to a video explaining the situation in a program in Kenya. I think, Cassia, over to you to present the video. I think we've heard from Philip, we've heard from Brianna, we've heard from Shikufe and Christine about the framework, about the return on investment, but seeing it in real brings the framework to life. Over to this 3-minute video. Cassia?
Wakati nikianza kwa mafundisho nilikuwa 4 months pregnant. Ilikuwa tuko kule hospitali ndo tukaelezwa kuhusu hiyo mafundisho. Ndo nikaona ni bora nijiunge na mimi nipate kujua how to raise a kid. Nilipoingia kwa mafundisho tulifundishwa hiyo kuhusu lishe, jinsi ya kukaa na mtoto, kumwelewa anachotaka, pia umuhimu wa kucheza na mtoto. Tulifundishwa pia vile ambavyo babake aweza bond na mtoto, kila wakati tuwe close na yeye. Ukachukua tu toys hapo mkacheza naye, pia naye akafurahia. Wakati kama yualia umwelewe ataka nini na shida gani.
We trained 2,083 niche parents. Parents were grouped into 46 groups. We have seen results whereby we had parents changing the way they were disciplining their children, getting closer to their children and getting attached to them. We have male parents now getting involved in the parenting because most of the times it's the women who are doing the parenting.
Pia mafunzo nashukuru, maana mimi nilikuwa na hasira. Pengine yualia mimi nampiga. Sasa nikaja nikaelezwa, nikaambiwa mtoto usimpige. Hata ukimpiga pia itakuwa muumiza na pia itakuwa kumwelewa shida iko wapi. Na pia mwanangu ana afya nzuri kwa sababu ya mafunzo, kwa sababu ya lishe bora.
As part of the Niche, the positive parenting program is being implemented in 4 counties, the counties of Kilifi, Turkana, Wajir, and Garissa. Since its inception, UNICEF has been working alongside the government to implement the program, which aims to educate parents on responsive caregiving, supports them in skills and the knowledge on how to provide safe and nurturing environments for their children. The program is implemented by trained community facilitators. After these sessions, parents receive a certification, which is an acknowledgement and a recognition of the skill sets and the knowledge they've gained during these sessions. We have seen significant strides in the achievements, and this would have not been possible without the gracious support of our partner, the British High Commission, through the World Bank, and as part of the Kenya Social and Economic Inclusion Program.
Thank you very much to our UNICEF colleagues for bringing this video to life. The Global Initiative to Support Parenting also has a whole series of videos, so we'll put the link in the chat, because I find sometimes we see this great framework which Christine presented, and then when you see the reality, it all seems so simple when you see the video, but in between what seems simple and what is very complicated, there are many steps. So I suggest that you continue showing these videos and making the link between what seems very simple and quite a complex framework that we need to work on. So with this, we're going to go into the country presentations, and we want to really thank the government of Pakistan and of Zambia for taking the time to present on their pledge and on the progress around their pledge. And with that, we are delighted to welcome Mr. Arif Legari, Director of the Ministry of Human Rights from Pakistan, before we move on to Zambia. Over to you, Mr. Arif Legari.
Sabine, just jumping in from the UNICEF side for my colleagues in Pakistan, I understand there's been an issue on their side, and it might be UNICEF Pakistan speaking now. I'm inviting Saba to join in and let us know who's presenting from the Pakistan side. Alternatively, we will go straight to Mangala in Zambia, and we can come back to Pakistan as needed.
Thank you, Sabine, and thank you, Christine. So let me introduce, my name is Dr. Saba Shudan. I'm representing UNICEF Pakistan, Early Childhood Development Manager. Unfortunately, in Pakistan, we are struggling with some, flood-related emergency right now. So Dr. Nazir and other government counterparts are actually are called upon to have this planning meeting. There's lots of, planning going on to respond to those emergencies. So if that's okay, I'll just, share a few, thoughts on behalf of Government of Pakistan, especially Ministry of Planning Development Special Initiative when it comes to parenting and caregiving. So in Pakistan, just like to highlight that the Government of Pakistan and Ministry of Planning Development Special Initiative.
Excuse me, Saba, yeah. I'm sorry, Dr. Arif Legari is already here. So if you can just give the floor so he can give an overview, and then you can just talk about the government initiatives.
Sure. So I will hand over to Dr. Legari if he's around. Thank you.
I see a Dr. Arif Mohammed. I don't know if I don't see.
Please, Dr. Saab, over to you, please.
Can you hear me, please?
Yes, we hear you perfectly, Dr. Arif. Over to you.
Thank you so much. As Dr. Sabha said, that Dr. Nazir was supposed to give the detailed presentation. Unfortunately, he is busy due to flood emergencies. Anyways, I will just give overview of the pledges. So far, we have taken actions in the Pakistan. Let me share that right after November 2024, when we pledged at the Global Conference, we developed an action plan in consultation with our federating units like Punjab, Sindh. We have the provinces, 4 provinces and 1 territory, Gilgit-Baltistan. So with regard to parenting pledge, we have 2 streams. In one stream, we developed a manual in the name of Art of Parenting. And that was spearheaded by our commission, National Commission on Status of Women. Then we have National Institute of Psychology, NIPS. Then Aga Khan Foundation, UNICEF, and other partners are also part of that initiatives. And after developing the manual, the next phase was to translate it in the regional language and national language. So we translated into Urdu as well. And after that, since November to August, we conducted trainings of the master trainers. So far, we have trained around 800 master trainers. And we have also engaged the community, and around 1,000 parents were approached and they were trained regarding parenting. And this manual is divided into 2 parts. One is targeting the age up to 9 years, and we call it Agosh. Agosh is an Urdu word which means, you may say, the lap, how to cater a child. Then the second is we targeted the adolescent children, and we call that manual as Parvarish. Parvarish means to brought up. We have targeted the master trainers in Islamabad Capital Territory and at national level. And we trained around 200 plus teachers and lady health workers who have frequent interactions with the community as well as parents. And similarly, in next phase, we conducted trainings in our province, Khyber Pakhtunkhwa, and having the focus on Peshawar and its vicinity. Peshawar is the capital of Khyber Pakhtunkhwa province. And over there, we trained 200 plus master trainers. Then the second part is Chitral, which is very mountainous and rough terrain and remote area of the KPK, Khyber Pakhtunkhwa province. And over there, we also trained 200 plus master trainers. And in third phase, which will start in the September, we will conduct trainings of the master trainers in Balochistan province, and similarly in other 2 provinces, Sindh and Punjab. Similarly, conducted trainings of master trainers, again 200 plus trainers were selected in Gilgit-Baltistan. So we are on the track. And with regard to financing, Pakistan budgetary scheme is like that. The of social protection. Similarly, the budget was allocated to child protection, welfare bureaus and departments and authorities. So within the given allocation, they further allocate the budget for this parenting and like that. If I give example of Ministry of Human Rights, like we have an operational budget. And in that budget, we have allocated certain budget to conduct awareness campaigns and to engage community and to develop child protection policy, focusing on the parent and community, and we have allocated certain budget. Similarly, we have also signed a rolling work plan with the UNICEF, and they have also allocated certain budget for these activities. And we have recently renewed that rolling work plan for the year 25 and 27, that we call the multi-year work plan. Similarly, we are also in negotiation with WHO and other partners to focus on this pledge particularly. The second pledge was the strengthening of the child protection unit. I have already given the presentation during our last session, I think 2 weeks before, like I gave the presentation to the audience. So we are on the track, and we are focusing on the nutrition part as well. As Dr. Sabat said, that the Planning Commission is spearheading that part with regard to parenting and nutrition needs. That is very much important, we believe. And we are also planning to engage the Ministry of Health as well for that purpose. And we conducted initial meetings with them, and very soon we will have the formal negotiations, and we will also invite the WHO and UNICEF for that purpose, that how can we carry forward our next plan for this year, how to achieve the targets and pledges we have already set. Yes.
Thank
This was
you.
the overview. Yes.
Sorry. Go ahead, Dr. Arif.
Yes. This was it on my part.
Okay,
Thank
perfect.
You.
Thank you. I'll just hand it back to Saba Shuja from UNICEF Pakistan, just if you want to add anything, and otherwise we'll move on to Zambia.
Thank you, Sabine. So most of the thing my government, dignitary already highlighted. I just would like to comment on one of the public financing commitment that Government of Pakistan through Ministry of Planning is, seeking towards parenting. So there is a public sector development program for 2025 and 2026, where there is a pledge of 8.5 million PKR for nutrition, and where based on the early childhood development, being parenting as a focus strategy, there are certain public sector funding allocation to scale up parenting with the domain of early childhood development, because we just recently, Government of Pakistan endorsed and released early childhood development policy framework, and out of the 10 strategic priorities, one of the core priority to scale up parenting program in Pakistan to uplift the child development domain. So I think this is one thing I just wanted to contribute. Otherwise, my government dignitary Arif Saab has already highlighted that what is happening in Pakistan. So over to you, Sabine. Thank you.
Thank you very much, Dr. Mohammed and Saba. Really wonderful, as you say, uplifting the child protection as an issue is so important, and seeing this happen in Pakistan, not only through programming but through budget, really makes a big difference. So huge thank you for this. And with that, we will hand on to our government colleague from Zambia, Ms. Mwangala Kalila, who is Senior Social Welfare Officer within the Ministry of Community Development and Social Services. Over to you, Mwangala.
Thank you very much, Sabine. Greetings, everyone. So from the commitments made in Bogota, Zambia made 3 major commitments. One was around developing parenting and caregiver supporting programs. The other was increasing budgetary allocation, and the other one was strengthening implementation. So what has happened so far, or what we have learned so far in implementation or securing dedicated funding for parenting support? Firstly, it's that integrated programming is very important. A key lesson that we have learned is embedding parenting support in broader child protection programming, rather than treating it as a standalone program. An integrated approach in programming is critical in parenting, because we leverage on already existing resources both in private and public. And our focus right now is on prevention, both prevention and response to promote child and family welfare. The second one is mainstreaming financing. So dedicated financing for support is often itemized as a separate budget line, but instead integrated into wider child-focused programming. This ensures that parenting support benefits from resources allocated to welfare and protection, including child justice, alternative care with a focus on reintegration, and marriage counseling. Those are specific budget lines that we already had even before the Bogota commitments. So recently we have seen an increase in those allocations, a steady increase in those allocations. Another one is a standardized case management approach. A unified case management approach that we are currently leading as government is one that we have adopted, and government with non-state actors as well as NGOs are using a standard case management approach. This helps in ensuring that everyone is pulling in the same direction. And then the other one is in the same line of case management. We're in the process of harmonizing case management tools and standard operating procedures. This will culminate into a national child protection management information system. And this will help us in monitoring and evaluation as well as in reporting. The other one is leveraging partner resources. Government with partners in 2019 developed a parenting booklet, and it has been used in selected places. Specifically, one example is Lusaka, which is our capital city, and this has been done with the support of Save the Children. And the booklet encompasses, right now we are in the process of reviewing it so that it can encompass emerging issues. Yeah. And then we are also, as we review the booklet, we're also looking at reviewing the handbook. Other activities that have been done in the same line is training of foster care parents aimed at ensuring that children in temporary care continue to receive nurturing and care. Another thing that we have learned is legislation and guidelines. You may be aware that the Children's Code Act in Zambia was enacted in 2022, and it provides for parental responsibilities in ensuring children are cared for and protected. And the law further provides for legal framework for intensive family support. And as a ministry, we have developed intensive family support guidelines, which will help in standardizing family-focused interventions, particularly for high risk or vulnerable households. And these guidelines underscore the emphasis of prevention of family separation as a core strategy. So our key focus is on prevention of family separation. Some of the challenges that we have encountered is weak coordination and sectoral coordination. Despite progress that we have made, we have seen that coordination among stakeholders is still weak within government departments as well as with civil society, and that calls for strengthening coordination. And then inadequate resources, we can't overemphasize that. Even though we have seen a steady increase, we still need more resources to all these parenting initiatives. And then the other one is the challenge that we've seen is limited human resource. There are very few social workers and very few volunteers that we have that help us with this kind of work. So what is it that would like other countries to what would share with other countries is ensuring that parenting support is legislated. For Zambia, we have it in the Children's Code Act, and that gives us impetus to be able to do what we are doing. Yes, and then when it comes to how we have been impacted by the cuts in foreign aid, we have faced programmatic setbacks. For example, we had USAID that was supporting many parenting programs, and now all those programs are not there anymore. And then we have had broader donor withdrawals. Some donors have also withdrawn. How we are responding, we are maximizing on existing partnerships. The ministry is leveraging on existing partnerships with civil society, and we are also developing new partnerships to be able to sustain these programs, and also integrating programs, not treating parenting programs as in isolation, but in each thematic area, embedding parenting programs is how we're responding. And then also enhancing referral mechanisms. Like I mentioned before, in our case management approach, we are ensuring that all stakeholders use the same guidelines, the same SOPs, so that we are, as a government, we will not be at loss if one program loses funding and so on. I'll end here. Thank you very much.
Thank you very much, Mwangala. Great to see the work in Zambia proceeding and progressing so well since the Bogota conference. Both Pakistan and Zambia have made impressive progress. And in fact, as we saw from Shikufa's presentation, many countries are doing work, but we felt that these were countries where there have been funding allocations which were worth highlighting as well. With this, I want to move on to our panel discussion. And so other speakers can leave their cameras on, but I would also request that Kudeli and Sanjana, Brianna add their cameras as well. We have some prepared questions, and then we'll leave time for Q&A. Dr. Mohammed, I'm sorry, you wanted to add something?
Just I want to share another information that in this financial year, Government of Pakistan under Benazir Income Support Program, that is a flagship program as a social safety net. And under that program, one segment is Nashonuma, development of children. For that purpose, this year, Government of Pakistan allocated around 32.27 billion rupees. And in addition to that, in 2024, WHO and Benazir Income Support Program also entered to an agreement amounting to $6 million. So the main target is to prevent the stunting among the children. And I think this is important information to be shared at this forum. Thank you.
Absolutely. Thank you, Dr. Mohammed. You have no idea how encouraging it is to hear these dollar/rupee figures. Really great to see that the investments continue, financial and not just political. So thank you very much. With that, I want to move on to a wonderful civil society partner, which are called ICS SP, Investing in Children and Their Societies. I just love the name of your organization, Kudeli. With that, we know that civil society organizations are often fully supporting the governments to implement their work. And my question to you is, in your experience, how have you felt that civil society has been supporting governments in building support for financing parenting interventions? So from the political side, maybe, and then practically, how have you seen this happen? Over to you, Kudeli. Oh, you're on mute, I'm afraid.
Thank you, Sabine, and good evening, everyone from Dodoma, Tanzania. As Sabine mentioned, I'm Kudeli Sokoina. I work with Investing in Children and Their Societies, one of the organizations which our main intervention to prevent violence being positive parenting. And for us, the good thing is we have the experience of working with the government and different partners implementing both in-person parenting program, but also the digital parenting, not only implementing, but also doing research to evaluate and see how effective those programs are in East Africa. And for the question which you have asked, some different partners and CSOs and NGOs support the government from different angles to deliver interventions that are related to prevent violence and violence against children. And us being one of them, our main role have been generating evidence to inform the government how effective the programs are in terms of preventing violence, but also how efficient these programs are. So we come from a background which we can do a comparative analysis on how the in-person parenting program are, but the digital program are. And we have been doing this in collaboration with different partners like Parenting for Lifelong Health, but also UNICEF Tanzania, the National Institute for Medical Research. And one of the main role have been supporting the government to implement the program, generate evidence, understand how effective these programs are in terms of impact and the result. And on the other side, hosting these programs to understand how efficient they are in terms of resources and the return for investment. Because for government to allocate resources and fund programs, they need to know the cost of implementing these particular programs, both the in-person but also the digital programs, the resources which are required, and what will be the return for investment if any single cent is allocated to ensure it will go down, it will reach the beneficiaries. What is the expected result which the government will be able to see? The other role which we have been playing is to support the government build its own infrastructures, systems, but also the human capital. Because for the government to deliver, they need to be supported in terms of from the technical side, so that the officials from the government have the required skills, have the required knowledge, and they know what it needs to be done and how they can do it to ensure the program is delivered to the community, but also ensure that they implement the program which is in line with the government policies, system and the structures, and they're able to track the program from designing to implementing to collecting results, but also doing documentation, so that they are able to table the results to the policy makers that this is what was done and these are the impact we are able to see. The other key role which we have been playing is to ensure these interventions are integrated within the government plans, but also policies and the programs. Because for the government, you speak of supporting the government to deliver programs or intervention at the scale level. And for that one to happen, you need to ensure that they are integrated within the existing government system and the structure, so that it can be implemented at the bigger level. The other thing which we also learned, and which we have been doing from our experiences, is to engage the private sector, especially when you want to do the digital. For example, when we were implementing the parent app in Tanzania, we collaborated with the Parenting for Lifelong Health, the National Institute for Medical Research, but also Vodacom in Tanzania, because the program is reaching to the beneficiaries using the smartphones. So we were able to bring Vodacom on the table, and they worked very well with us to ensure the beneficiaries will be able to get the internet, and they're able to go throughout the apps, they're able to download, they get supported, they understand how to scroll the app, they learn. But at the end of each modules, there are questions which we were asking those beneficiaries to respond on, Then when they respond, and they at any time, because they learn offline, but at any time when they connect to the internet, now the response will be able to go to the dashboard, and we are able to understand how many parents were able to learn today, what topics, and what is the feedback which they are providing. And we as civil society, as we think of supporting the government, we should also think how we support the government to have those infrastructures. And when they are delivering the digital programs, they have infrastructures which they can be able to track and see and understand what is happening. So as I conclude what I am saying, supporting the government to generate evidence on the effectiveness and the efficiency of the program is very key, but also support the government to understand the cost which is involved to deliver the digital program, so that they're able to make informed decision to finance the program and implementing at a big scale. Thank you for this opportunity, and I'll be able to answer questions if they'll be able from the participant.
Thank you very much, Kudeli. And it was a great intervention. And I've seen Kudeli live in Tanzania doing exactly what he's saying. So it's really not in theory, it's very much based on 100% practice, and in other countries in Africa as well. With that, I want to move on to our wonderful colleague from Grand Challenges Canada, Sanjana Janardanan. I met Sanjana in one of the webinars that she gave, which she organized on the role of the health sector and parent and caregiver support. And we saw it a little bit on the video from Kenya, how the health sector can play an important role. But basically, Grand Challenges Canada has been doing wonderful, groundbreaking work in supporting parent and caregiver support programs across the world. So my question to you, Sanjana, is what role do you think philanthropy can play in testing innovative parenting models? And what are some of the examples that you've seen or funded between philanthropy and government to bring programs to scale? Over to you, Sanjana.
Yeah, thanks, Sabine. And I think it's really interesting. I'm going after Kudeli because I think that's a really innovative approach that he described as well. So yeah, like you mentioned, at Grand Challenges Canada, we are an impact-first investor based out of Canada, and we've been investing in ECD programs and services for more than a decade. And we do have a significant cluster of investments that we've made over the years in parenting programs and caregiver support programs. And I think, thinking about what the role that philanthropy plays in testing these models, typically what we've seen is that the role has been in funding, the whole journey of testing, right, from pilots to evidence building to the scaling approach. And what we've seen in our portfolio is that many of the parenting initiatives that we've supported are aiming to do that towards improving the quality of public systems. So we see, just the description that Kudeli did, but also I'll give you a couple of examples of how we've seen innovation trying to improve the quality of public infrastructure that would increase access for families and children to parenting support, particularly in adverse settings. What I'll share today is I'll give you two examples from an innovation lens, and then I wanted to also pivot a little bit and talk about how we're working directly with governments as well, which is much more experimental and we're still learning. So excited to learn together with everyone as well. So one of the first examples, and I think there are maybe people here who are attending the webinar who know this program quite well, is the Sujira Muryango program in Rwanda, which is a 3-month parent coaching intervention that's delivered at home by child protection workers. And this is for families who have been identified by the government as priorities for poverty graduation. So they're graduating from poverty and therefore are eligible for cash transfers, so very much within the social protection system. The impact of this program has been, being implemented over many years, and the impacts have been quite deep and wide-ranging. So we've seen improved caregiver mental health, we've seen stronger parent-child bonding, reduced harsh discipline, for instance, and the role that donor financing has particularly played here. It's a coalition of donors who've supported this particular initiative, has been to help that refine its model, improve cost effectiveness, and build that prototype for scaling, all in collaboration with kind of local and national government. We're at a point now where it's scaled in 3 districts, moving to the 4th, and is positioned to support the National Child Development Agency in its goals to improve the child protection workforce. And we're we're very much on that pathway for adoption, even as we speak. Another example is from Brazil. This is the Programa Criança Feliz. It's a home visiting program that's been adopted by the federal government and implemented in the municipalities. There was some interesting political dynamics here. It was a previous government's initiative. And when they decided to do it, it was pretty top down. There was some local resistance. And when they did an RCT, they did see that the program didn't have very strong outcomes. But rather than stepping back, the government, along with philanthropic partners like GCC, LEGO, Brazilian philanthropies like FMCSV, leaned in. And what it did was we opened the door to saying, okay, we have this program, can we test more evidence-based approaches? And so we actually saw the government agree and step up and say, let's continue to test how this program can be more effective for children, and which opened the door for us to increase the reach of programs like Reach Up and Care for Child Development, which we all know are evidence-based programs reaching children. What GCC is supporting is a kind of new municipality leadership program in this particular initiative that's rewarding early adopters from municipalities and enabling them to help kind of neighboring municipalities to improve quality as well. So it's very much an implementation research that's ongoing, and we'll be sharing findings as soon as we have them. So it's in the test and validation phase. In both these cases, donor support was critical in supporting and establishing the innovation. But without the parallel work on linking with government priorities, financing still remains a pipe dream. And in all candidness, we do still have a long way to go. So we're learning a lot. And what I'll highlight is two important lessons that we have learned. One is that when innovation is driven top down by donors, even by government, like what we see in the Brazil case, we often end up with what I term a pileup of interesting pilots that may not actually be connected to government demand. So as much as we'd want to see there be a pipeline of interesting innovations that's reaching government, that's not happening because it's kind of more top down. The other things is that while many of these innovations are promising on paper, when they are developed outside of public systems and exceed what they can reasonably take on, we find that there are strong barriers for adoptability and scalability. And so that's why at GCC, we've been adding a more demand-led approach to our kind of repertoire of investments that we're making. An example I can share is in Kenya, and this is not parenting focused, but I think there's some interesting lessons here, where with Results for Development and Inside Health Advisors, we tested a model called Mountain Model, which was rolled out in 14 counties in the Lake region in Kenya, which is a facilitated process that helps local governments articulate their innovation needs, identify suitable solutions, and allocate their own budgets for scale. We also kind of helped support that through tools like, creating these innovation investment cases that the county people could use to advocate internally. And also, we probably need more of this, but we don't have enough, like diagnostic tools, like Spring Impact has one, which enables governments to determine if an innovation is ready for scale. What stood out was that two counties kind of showed up as strong kind of first adopters and selected some innovations. And what's interesting is that the innovations that were selected by counties were not all GCC funded. So there was only one that was actually GCC funded. And that's really the point, that the process was led by local demand and not by donor supply, essentially. So building on these lessons, what we're really now focusing on is partnering with others who support governments to strengthen things like their procurement systems and decision-making systems with the goal of making space for innovation and to sustain. I'll stop with this last point, and I'm really interested to hear what y'all think about this, is that what we've really learned is that we need to reduce kind of planning for the systems we wish we had and start planning for the ones that we do have. Because what we've seen is when we align with like real system capabilities and government priorities, that opens up the door to enable the adoption of innovation. And then we start to see increases in public investment, like what we saw in the Kenya example that I shared. They did start allocating resources to scale some of those innovations as well. And this is a crucial step towards longer term scalable impact. So I'll stop there and excited to hear the questions.
Thank you, Sanjana. Really great intervention. And I want to move on immediately to the next question. I had one up my sleeve, but I think there's such a great one in the chat that I'm going to take that one. For both Mwangala and Dr. Mohammed, how can you ensure that parenting programs reach all those that need it and not just those from lower socioeconomic backgrounds, which is often what happens? It was often considered a colonial approach where we impose it on families from lower socioeconomic backgrounds. I think it's such a brilliant question, and maybe this time I'll let Mwangala speak first, and then Dr. Mohammed and Sanjana, if you have any thoughts on that question as well, and of course Kudeli and Brianna. Happy for you to jump in, but we'll start with Mwangala and Dr. Mohammed.
Thank you very much, Sabine. So firstly, the presentation, some of the issues, because of time, are not mentioned. So because of this question, I can add to what I said earlier. So we do have parenting support embedded in healthcare, in antenatal care. When mothers go for antenatal care, they get some services in that regard. So using that, we're able to reach everyone, because going for antenatal care is not limited to those that are of a lower class, if you like, or at risk. It's everyone who goes through that. And then another approach that we currently have is through Ministry of Education. Ministry of Education as well reaches parents. So all children go to school. It's not limited to those that are at high risk or whatever. It's all parents that take their children to school. Because right now for Zambia, we have the free education policy. So that even those that are of a higher class or lower class or whatever, they take their children to school. So we can reach them in that regard. And one thing that I have picked from now, which I think we would be able to also replicate, is the lesson using mobile service providers, because many people now have mobile phones. And through that, I think we can actually reach more people, not only those who are at high risk. Those ones may actually not have mobile phones, the modern touch screen and whatever, but we are able to reach everyone. Yeah. So I think from the Zambian perspective, yes, thank you.
Super, Mwangala. I'm so fascinated by everyone's responses. I'm going to ask you to keep them to just 1 minute. So Dr. Mohammed, then I want to go back to Sanjana, Kudeli, and Brianna. Just 1 minute.
Sabine, this is very important question because it was also discussed when we were in consultation process while developing this manual of art of parenting. In Pakistani context, we have developed this approach very carefully in the ambit of constitutional guarantees and international obligations. What rights have been given to an individual, to a child, to a parent, to a family that has been protected. State is not going to impose any narrative on them during the parenting. They can brought up their children in their cultural context, in their community context. But yes, with regard to health, it is the constitutional guarantees given, and Pakistan, the Constitution of Pakistan has a separate chapter on principles of policy. What state has urges under that principles of policy? One is to eradicate social evils. Second is to provide shelter, to provide food, to provide clothes. So these are principles of policy of the state of Pakistan given in the Constitution. So that's why we are targeting the communities, and we are targeting systematically in a way that I have mentioned, Benazir Income Support Program. Under that program, we have a poverty score. We have chalked out the families and the children who need the nutrition programs, who need education, who need parenting. Similarly, you know, Pakistan has been badly hit with the terrorism as well. This was the greatest challenge for us, especially to save our adolescent children and youth. For that purpose, Government of Pakistan has established centers of excellence to counter the extremism. So, according to our need and under the constitutional obligation, as well as considering the international commitments, the state of Pakistan is going to introduce such initiatives of parenting and positive parenting. Yes.
Thank you, Dr. Mohammed, for this very comprehensive response. Sanjana, and then Kudeli, and then Brianna. Same question. How do we reach all socioeconomic groups?
Yeah, I'm actually very inspired by the UNICEF presentation earlier today, which showed that framework and showed that pyramid where you had the base level, which is universal, and then there was targeted, and then there was like customized in that sense. And I know the Parenting for Lifelong Health folks have done a lot of thinking here that describes kind of what are strategies that are within the universal parenting element. How can we do that? How can we get like a base level of service that goes to all parents and at a lower cost, and then have like kind of higher, maybe cost-driven interventions to really be tailored to specific populations? So I'm really inspired by that framework. I'd say what we're learning from the innovations we've invested in is that the principles of flexibility and customization are intertwined. So the opportunity is to think about how we use digital tools, for instance, that can potentially reach more people, but also ensure that the folks who are delivering in-person interventions, for instance, are able to navigate kind of the large amount of content and curriculums available to be able to quickly customize to the families that they're meeting. So they don't, so there's some kind of really interesting work that's happening in the Brazil example, where they are looking at flexibility as part of the interventions that they are delivering as well. So that's kind of where my brain is going. Of course, being able to adapt innovations to the health system when possible, like what we're seeing in Rwanda with the Bandaberry Hope program, or integrated with social protection when possible. I think the idea is to see how we can make it modular and fit with multiple systems so we can quickly take it across. That's what's exciting to us, at least.
Thank you, Sanjana. It's a nice segue to Kudeli, and as you have the mic, Kudeli, if you can answer that question, but I see there's another question in the Q&A for you about the digital parenting program, and Sanjana referred to it as well. So maybe you can say, how in person do you reach the different socioeconomic groups, and what do you think will be the role of the digital parenting programs, and how is the government using it and adapting it? So like 3-in-1 questions, Kudeli, over to you.
Okay. For the first question, quickly for me and with our experience, I will say 3 things. First, to reach as many people and all groups, we needed to invest and channel our intervention through the existing government system and structures, because the government have its own way of how to reach its people from national level to the local level. Take an example like the health system. It reaches as many people up to the local level. So we need to use and invest in the same system so that the same people who are able to access health services can also access parenting intervention. The same goes to social welfare services and its system. The same goes to economic interventions. So if we are able to support the government, build a strong system, but also have the required technicals to deliver the program, we will be able to reach all the people. Number 2 is about using the multi-sectoral approach. For example, in Tanzania, together with our partners, we are working together, and we have supported the government to establish a multi-sectoral approach in which all the partners, both from the government, private sector, and the NGO sector are able to come together, reflect, plan, and agree how is parenting going to be delivered in the country. So from the multi-sector approach, we will be able to reach as many people as we can. And number 3 is about supporting now the government to develop the scale-up strategy. If every government is able to develop the scale-up strategy, it will be clear what are we scaling, what kinds of intervention are we delivering in the country, and what will be the channel for us to deliver those kinds of intervention. Then from there, different investors who are coming, for example, in Tanzania or in any country, and they want to invest in violence prevention using parenting as one of the very key approach, they will be able to invest through the channels which are in the scale-up strategy. In terms of the parent app in Tanzania, we have been implementing it, but also the way I said, in collaboration with the National Institute for Medical Research, but also Parenting for Lifelong Health and others. So what we are doing, the app was developed. It has a content on positive parenting. The parents are mobilized at local level. They have their own phones. They are able to learn. They are able to be supported to onboard. First, download the app in their phones, but also and they get supported to understand how they can learn offline in each modules. They can be able to scroll themselves. They learn, they understand. Not only learning, but also there are audios in, they can listen. Then they can reflect with their own families. And we have been doing research to see how effective is that programs. And the results are very, very positive in terms of impact, but also in terms of cost. And we are able now to compare with the in-person program to see if we invest in the in-person, these are the cost and these are the resources which are required. But also if we invest using the digital programs, these are the cost. So all the people with smartphones, and we know now technology is very big. People are in the social media, are in different platforms. So for example, if you are in your car and you are just moving from your office to home, you can spend the 20 minutes in the car to learn one module. And when you reach home, you will have acquired the very good skills which will help you on how to create safe environment, positive environment, how to interact, how to talk, and how to communicate with the children, how to understand their own issues and the environment you are going to create on addressing those matters. For now, what we are doing, we are supporting the government because we wanted to have the result first before we go to the government. So now, since we have the evidence, we are in the table with the government, supporting them first to understand the program very well, supporting them to develop the scale-up strategy in Tanzania on how they can adapt the program and how they can implement it in the country. The government is very excited. Is very excited to go with that program, but we are going with them step by step to ensure they will be able to implement in a very good way. Thank you.
Thank you so much, Kudeli. There was an interesting, as you were speaking, an interesting message in the chat about that also means more screen time for not only the young people, but also for parents. And how do we manage that? Because if we're trying to engage more with our children, but we're more on our screen on both sides as parents and as children, then we face another challenge. But we'll cross that bridge when we get there. I just want to, we only have 5 minutes left, and I just want to give a bit of space to Brianna. There's a message from some Q&A in the Philippines who is saying, how do we focus on childhood trauma healings? We know that many parents that become violent and that struggle with parenting is often just a trigger of their own childhood wound. So I'm just leaving that there, Brianna. I'm not going to expect you to answer it because it's a tough one to answer. And I don't know if you're a psychologist or a psychiatrist, but I don't think so. But my actual question was, what has been the impact of parenting programs in your community or life? I put the other question there for you to do with it to see if you want to try to address it, But I think more importantly, looking forward, what do you feel has been the impact of parenting support interventions, either in your life or in your community?
Okay, thank you so much, Sabine. And that is a very difficult question, I would say. I'm not a psychologist or psychiatrist. I studied psychology in university, but that's about it. But I think what's really beautiful about parenting programs, especially the ones that I've personally been a part of when it comes to even parents talking about their own childhood traumas, is that a lot of these parenting programs that we have, they operate in a group intervention or group setting. So when it comes to, for example, modules on talking about feelings or talking about emotions, they're able to also share about what they experienced as a child and what they want to do moving forward and how they want to heal from that. And so I think parenting programs in general are a very good space just to facilitate that kind of healing. And at least the parenting programs that we have in MAPA here in the Philippines, we also have not only the parents, but also often the teenagers involved in these parenting program settings. And so when we facilitate a discussion between the parents and the teenagers about, for example, what the parent experienced and how that also impacted their parenting of their teen and how the teen felt in return, it just gives an opportunity for them to have honest conversations about that. I don't think that completely answers the question, but very, very happy to talk about it more, I guess, in another time. And I guess in terms of the impact of these parenting programs in my life and in my community, it's just very similar to what I mentioned earlier, like what we teach in parenting programs about the spending one-on-one time with the child, talking about emotions, giving positive praise and discipline, establishing routines, resolving conflict as a family. All of these are very, very important life skills that all of us, regardless of what age we are or whether or not we have our own children yet, these are very important to learn and to know. And so at least the people that I've encountered who are part of these parenting programs and who are the ones facilitating these, I've seen the positive impact it has in their life. I mean, even with my other colleague to talk about using, for example, like the different skills that we teach in with our own siblings, with our own younger siblings, and with our own parents even. And so I feel like that's a kind of impact that is very hard to quantify or to become tangible, because it's something that happens over the course of a lifetime, I would say. And in relation as well to the question earlier about how do we make sure that parenting is not only accessible to a specific population, I think the beauty of this, at least, is that a lot of the parenting programs that we have, and I believe as well under Parenting for Lifelong Health, are open suite and open access. And so at least coming from my perspective as a young person and a young advocate and a program developer, what I really hope to see actually moving forward is to open these conversations about parenting and caregiver support to the broader community. Because one, right, changing mindsets takes time. And if we can begin these conversations and learning these skills, for example, in schools and universities, then by the time that my generation steps into caregiving roles, then we already know what healthier alternatives there are, instead of violence as the only model that we've seen. And actually, I led a regional youth consultation here in ASEAN and Timor-Leste with young people aged 18 to 24, and we received about 1,100 responses. And across those 1,100 responses, actually, the #1 pledge that they wanted prioritized for their governments is parenting and caregiver support. And so this just really shows how important it is, not just to the current generation of parents, but to my generation as well. And I guess that's a good way to also close this webinar. So yeah, thank you so much.
Thank you, Brianna. I mean, I couldn't have closed it better. I think you've said everything that needs to be said. It's been really wonderful to hear the different speakers. We've touched on the importance of joint planning, of it being demand-driven, of multi-sectoral work, of moving to digital delivery, of having a scale-up strategy, of involving the broader community. We've touched on so many important points. We don't do these digital dialogues for nothing. We're really doing them so that we can track what people are saying, so that we can see the recommendations and then start driving them forward through the pledges and at global level. So really, thank you again to the governments of Zambia and Pakistan. Thank you to Philip, to Shekufe, to Brianna, to Christine, to Kudeli and Sanjana. Really great interventions, and I wish you a good continuation of your day and evening, and look forward to speaking to you again. Bye-bye.
Bye-bye. Thank you.